Hello everyone, Shawn Whatley here again. I wanted to tell you what we've been up to recently. Last week was packed. We had an advocacy day planned for Wednesday, and wouldn't you know it, the government planned to drop their budget that day. So we had to adjust at the last minute, but we still got a ton of work done and we want to tell you about it. So on Tuesday, we kicked things off with the introduction of our election platform. We've done a ton of work on this and we are really excited about sharing it with a large group of stakeholders within the healthcare system at the OMA. Our keynote speaker was Nick Nanos. He reviewed the political landscape, things that are going on, what we can expect in this election. We heard people whispering in the crowd, why didn't we think of doing this? We're going to show you some clips. I have a special copy. We've got one wrapped for Kathleen Wynne. Every single member of provincial parliament is going to get their own personalized copy of our platform. So I think it's fantastic that we have a room full of people who all care about healthcare, all care about patient care services. And our job today is to figure out where we align, because we're all one big family. And if we're going to make change in the election, it'll be about working together to force change. So right after breakfast, we headed down to Queen's Park and had a presser with media and members of the legislature. One of the key questions there was, how do cuts impact patient access to care? We want to share a clip with you about that right now. We need to keep Ontario attractive so that we can draw top talent to Ontario to care for our sickest patients. I'll give you a concrete example. In my community, I'm just north of Toronto, we have a catchment area of about 1 million. Our emergency department is the third largest in Ontario. We had one vascular surgeon for years. We were begging to get another vascular surgeon in. Well, that vascular surgeon has many opportunities to look, not just in Ontario, but across Canada and indeed across North America. They see our sickest patients, and when I call a vascular surgeon at 3 o'clock in the morning for someone who has a rupturing artery in their abdomen, I need them there in about 20 minutes or that patient dies. So you can't ignore the fact that doctors have been cut for the last 6 years in our ability to recruit and retain top talent, especially for the care that our most vulnerable patients need. After that, opposition critic for health and long-term care, Jeff Urich, stood up and asked some pointed questions of the Premier. Why have they been ignoring doctors? Why have they been so oppositional with us? Why are the wait times so long? Check out the clip.
Thank you, Speaker. It's the patients who are suffering due to this government's inability to work with Ontario's doctors. They've refused to work with OMA and failed to fix the strained relationship with the healthcare professionals, which have lost opportunities for patients to access improved care. Our wait times are out of control for surgeries, for mental health treatments, our hospitals are overcrowded, and we have an opioid crisis which has overtaken our province. This government has failed to properly manage the healthcare system. My question to the Minister, after 15 years of cuts and vilifying our doctors, how can Ontarians trust you heading into the election?
At the same time, we spoke with a number of MPPs who signed our Not a Second Longer pledge, committing to lowering wait times in Ontario. In addition, we got the opportunity to listen to Premier Wynne talk in her first speech after launching her budget. She talked about the need for care and not cuts. In fact, she went out of her way criticizing how anyone could possibly consider cuts in Ontario right now. I was able to ask the first question. They only allowed 2. And my question was this. You mentioned that you have a passion for care and not cuts. And yet, for the last 10 years, we've seen sub-inflationary increases in the hospital sector, and indeed the doctors of Ontario have had 6 straight years of cuts. So I'm wondering how you're expecting voters to overlook that fact. Thank you. Needless to say, her response was long on political answers, but very short on details. Regardless, it was a great opportunity to let her know that we're going to continue to hold her to account during this election. So as you can see, last week was incredibly busy. On top of that, please check out the link below to see our ad campaign. We want to know what you think about it. We have a detailed budget analysis coming out very shortly. The next few months are packed and they are going to be exciting. Please stay tuned and thanks for watching.